Hello, all. Today's discussion will be about vitamins in adult athletes, and my name is Selena Ramirez, and I'm here with my colleagues. I'm going to go ahead and introduce themselves.
All right, I'm Jessica Ferguson.
And I'm Stephanie Gomez.
So we're going to go ahead and move forward with the discussion today, and Jessica's going to jump us off.
Right. So we want to talk about the importance of vitamin intakes in athletes and why they're essential for them. A vitamin deficiency in athletes can adversely impact the body's ability to regulate its repair process, possibly interfering with performance. Micronutrients are crucial for energy metabolism, hemoglobin synthesis, bone health maintenance, and immune system stimulation. Overall, increasing these micronutrients is necessary to support the development, repair, and preservation of lean body mass in athletes. Unfortunately, depending on the athlete and their sport, they may be at risk for deficiency. There are numerous ways in which athletes can alter vitamin requirements. Some of these these risks can be reduced absorption of those vitamins from the gastrointestinal tract, increased loss of vitamins through sweat or urine, increased utilization of vitamins due to physical stress imposed by exercise, increased need, particularly in individuals aiming for substantial muscle gain in its maintenance, and lastly, we have energy-restricted athletes. This category of athletes include female gymnasts, ballet dancers, wrestlers, and jockeys, since they often maintain diets with insufficient vitamin intake, considering they may be trying to maintain a physical physique. In conclusion, vitamins have an essential role in an athlete's diet. Today, we will discuss some vitamins we prioritize specific to athletes, backed by supporting research. All right, next slide. First, I wanted to briefly just introduce B vitamins. As in the next slide, I will talk about the overall significant role they play in various metabolic processes within the body. B vitamins are a group of essential water-soluble vitamins, which means they cannot be stored in the body and will have to be consistently replenished via diet. Below, we have included 6 of which my group have decided relate to athletes, starting with thiamine, being that it is essential for energy metabolism as it converts glucose into energy, and it is also crucial for maintaining a healthy nervous system. Riboflavin is important for energy production, and it also contributes to healthy skin and vision. B6 is required for protein and carbohydrate metabolism, I can't speak, the formation of red blood cells and certain brain chemicals. It also plays a role in immune function and steroid hormones necessary for brain development and function. Niacin is also involved in DNA repair and plays a role in energy production by converting carbohydrates, fats, and alcohol into energy. It also helps maintain healthy skin, nervous system function, and digestive system. Pantothenic acid is essential for energy production via the metabolism of carbohydrates, proteins, fats, and alcohol, and they can help produce red blood cells as well as steroid hormones. They also play a role in gene transcription and promote transcription. Biotin helps release energy from carbohydrates, proteins, and fats. It is also involved in the transcription of some genes. Now, as you can see from sources, B vitamins can be found in a variety of foods, and a well-balanced diet typically provides sufficient amounts. However, certain individuals, such as vegetarians or those with specific medical conditions, may be at risk for B vitamin deficiencies and may require supplements or dietary adjustments. B vitamins are crucial for overall health and well-being, supporting energy production, a healthy nervous system, and various metabolic functions in the body. Next slide. All right, and all these B vitamins that I just discussed in the slide before are collectively known as B complex vitamins, and they contribute significantly to the energy metabolism process. Their primary functions lies in the generation of adenosine triphosphate, also known as ATP, and they actively participate as coenzymes in the regulation of these energy-related reactions. While they are integral to the energy process, it's important to note that B vitamins do not serve as a direct source of energy. despite frequent claims in supplement advertisements. And consuming excessive quantities of B vitamins does not lead to the production of more enzymes or an increase in enzymatic activity. However, without B vitamins, the body will lack energy. This is because these vitamins are essential for enabling the body to effectively utilize energy-yielding nutrients like carbohydrates, fats, and proteins as fuel. Additionally, other B vitamins play a critical role in facilitating cell replication by aiding in the synthesis of new DNA. Athletes at risk of B vitamins intakes and potential subclinical deficiencies are often those who restrict their caloric consumption, eliminate specific food groups from their diets, or consume nutrient-poor foods, particularly those high in sugar and low in vitamins. And I just wanted to point out, so if you can see, I guess kind of in small writing down there, how NAD contains niacin, FAD contains riboflavin, how all of these can kind of contribute to this vitamin B complex, and they all play a role in the body. So, all right, next slide. So cyanocobalamin, also known as vitamin B12, plays a vital role in several essential bodily functions. It plays a significant role in the production and maintenance of myelin sheath that surrounds nerve cells, contributes to cognitive function, aids in the formation of red blood cells, and facilitates the breakdown of certain fatty acids and amino acids to generate energy. Additionally, vitamin B12 and folate have a symbiotic relationship depending on each other for their optimal functionality. However, since vitamin B12 is exclusively present in animal-derived foods, individuals following a strict diet, as well as breastfed infants of vegan mothers, and also vegans, are at a higher risk of deficiency. To lower this risk, they may need to rely on specially fortified foods or yeast-based supplements. Symptoms of vitamin B12 deficiency include fatigue, nerve cell degeneration, numbness, and a condition known as pernicious anemia, which often requires monthly intramuscular injections for effective treatment. All right, so next slide. Okay, next we have vitamin A, which is part of a group of antioxidant vitamins, which means it has the ability to counteract free radicals produced during intense physical exercise. An adequate intake of vitamin A can play a crucial role in neutralizing reactive oxygen species, or abbreviated ROS, therefore preventing conditions like heart failure and muscle damage. This essential nutrient performs a range of major physiological functions, promoting the overall health of cells and cell membranes. It supports proper vision, reproduction, bone and tooth development, and immune health. In terms of dietary sources, vitamin A can be found in animal-derived foods such as liver, fish oil, and fortified milk and dairy products. Plant sources like dark green leafy vegetables like spinach, and orange fruits and vegetables such as carrots and cantaloupe. Insufficient vitamin A intake leads to deficiency disease known as hypovitaminosis A. Hypovitaminosis A, there we go. Recognizable symptoms include impaired night vision, which may progress to night blindness in its early stages. Younger individuals tend to experience more severe effects of vitamin A deficiency, including compromised immune function, which can lead to chest and throat infections. Overall, deficiency symptoms can lead to immune system dysfunction, stunted growth, and fertility issues. Okay, next slide.
Vitamin D is a fat-soluble vitamin important for bone growth and development, regulation of cardiac and skeletal muscle, and cellular growth. Vitamin D can be obtained in 3 ways, which is the consumption of vitamin D containing foods, ingestion of supplemental vitamin D, and exposure to UV light. The best sources of naturally occurring sources of vitamin D are fish, such as salmon, mackerel, tuna, and fish oils, fortified dairy and dairy products, such as milk and yogurt, and egg yolk. The recommended intake for vitamin D for ages 19 to 70 is 600 IU or 15 micrograms, and the tolerable upper limit is 400 IU or 100 micrograms. Vitamin D deficiency can lead to osteomalacia, and its symptoms include vomiting, headache, diarrhea, polyuria, calcinosis, and fatigue. Just to note, osteomalacia is a softening of the bone, and that again happens when there's insufficient vitamin D in the diet. Some environmental factors affecting UV exposure for vitamin D intake include the latitude, season, and exposure time of UV. Other factors that may affect vitamin D pertaining to UV would be skin color due to melanin blocking UV light and use of sunscreen also blocking UV light. Next slide. So to start off with the roles of vitamin D, we must note that there are two forms. One is ergocalciferol, which is found in plant foods, and cholecalciferol, which is synthesized in our body or found in plant foods. Vitamin D is produced when UV rays from the sun strike our skin to start vitamin D synthesis. From the UV, Pro-D3 will be converted to vitamin D3 to be absorbed into the liver. From the diet, vitamin D2 and D3 will be absorbed into the liver as well. In the liver, 25-OHD will be transported to the kidney by the blood to be converted to its active form, calcitriol, or 125-OHD2. Calcitriol will regulate blood calcium levels, which involves the kidney, intestines, and bones. Calcitriol will regulate calcium metabolism and homeostasis to help in calcifying bones to prevent muscle contractions and maintains calcium and phosphorus levels in the blood for other functions such as metabolic functions, bone strength, and neuromuscular functions.
All right, so we have vitamin C, which is a water-soluble vitamin and a powerful antioxidant that is important in helping the body reduce the damage done by free radicals, which are created from environmental stressors, poor diet, and even extraneous exercise. But it has another important functions as well, from aiding in iron absorption to supporting fast healing. Helps with collagen formation, helps to protect cells and support wound recovery, and allows the body to, I already said the iron. Sources of this vitamin can be found in citrus fruits, tomatoes, and red or green peppers. Pregnancy can influence RDA requirements, as can be seen here from the 75 milligram requirement for females to the 85 and then to the 120 milligrams. A deficiency, although is rare, could lead to scurvy. Symptoms of this disease include bleeding gums, petechia, or easy bruising, and impaired wound healing. All right, next slide.
So vitamin E acts as an antioxidant and enhances immune function and prevents clots from forming in heart arteries. Sources of vitamin E include nuts, seeds, and vegetable oils. And the recommended daily intake is, if you're above the ages of 14, it is 15 milligrams a day. And if you are a lactating individual, it is 19 milligrams a day. So vitamin C and vitamin E have this dynamic interplay that allows for the regeneration of vitamin E from vitamin C. So ascorbic, also known as vitamin C, provides electrons to free radicals and is oxidized in the process. And vitamin E also acts as an antioxidant and is oxidized. So vitamin E can be regenerated by vitamin C. And once vitamin C is oxidized, it is regenerated by glutathione, and glutathione is regenerated by the NADPH electron transfer. So this, within the cellular level, just helps reduce the amount of free radicals and prevent continuous cellular damage. So we're going to go ahead and talk about a little bit of the literature review that we found and some of the recommendations.
All right, so this is relating to the B complex vitamins that I just talked about. So this study, the primary objective was to assess the potential anti-fatigue effects of a 28-day supplementation with vitamin B. specifically vitamin B1, B2, B6, and B12, and its impact on enhancing exercise performance. The participants included a total of 32 healthy adults aged between 20 to 30 years old. These individuals were divided into two groups, the placebo group and the X plus group. Subsequently, followed with a 14-day washout period, was implemented after the intervention. Participants in the X plus group were administered one tablet of the X plus tablet daily for the entire 28-day supplementation period, which each tablet included vitamin B1, B2, B6, and B12, and then vitamin E, as well as some other components. But I figured since this is relating to B12 being my focus, vitamin B vitamins being the focus, I went ahead and included right there how many milligrams for each or micrograms. And the placebo group received identical looking placebo tablets that did not contain the active ingredients in the experimental tablet. It looks the same, but it's not the same active ingredients. And then there we go. To evaluate the impact of the supplementation, various outcome measurements were assessed. So this is back to the other slide we're just at. So the outcomes, these included measures of body composition, common blood, biochemical parameters, and exercise tolerance before each phase of intervention. After the 28-day supplementation period, the study measured exercise fatigue, biochemical values, exercise endurance performance, and body composition. Additionally, these participants were asked to record their dietary intake, which was later analyzed by a professional nutritionist to ensure the diet did not affect sports performance-related outcomes. And the results, as you can see here, revealed a significant enhancement in exercise endurance performance. It demonstrated a noteworthy 1.26-fold increase in running time to exhaustion compared to both the pre-supplementation period and the placebo group. Moreover, the X plus supplementation group results significantly reduced concentrations of blood lactate and blood ammonia during exercise and post-exercise rest in comparison to the placebo group. These findings indicate that the experimental supplementation effectively reduced fatigue-related metabolites such as lactate and blood ammonia, commonly associated with the muscle fatigue during physical exertion. In summary, the 28 supplementation of vitamin B complex, the X plus, resulted in a substantial improvement in exercise endurance performance and notable reduction in exercise-related fatigue metabolites among the study participants. Importantly, the supplementation was well tolerated and did not yield adverse effects when administered at appropriate doses. All right, next.
For vitamin D supplementation in athletes, I was able to find one article titled The Effect of Vitamin D Supplementation on Serum Total 25-OHD Levels and Biochemical Markers of Skeletal Muscles in Runners. So in Zabrauskas et al. Double-blind randomized control trial, the purpose of the study was to evaluate the effects of serum 25-OHD and skeletal muscle biomarkers before and immediately after eccentric exercise and during post-workout recovery. So 24 ultramarathon endurance trained runners were blindly randomized to either the experimental group or the placebo group. The experimental group received a vitamin D cholecalciferol supplementation of 200 IU for 3 weeks, and the placebo group only received gelatin capsules. Participants also engaged in eccentric muscle damage exercise of a 30-minute downhill running as a part of the exercise protocol. This form of exercise is an effective way to cause a load on skeletal muscle to induce delayed onset muscle soreness, also known as DOMS. Outcomes were measured by serum 25-OHD levels for vitamin D status. And for muscle damage, it was creatine kinase, lactate dehydrogenase, and blood lactate concentrations. Results of the study conclude that the serum 25-OHD levels were significantly higher post-intervention, meaning post-workout, in experimental vitamin D group compared to the placebo group. For muscle damage, the increase of experimental vitamin D group for muscle damage, the increase of Serum 25-OHD levels also resulted in a decrease of creatine kinase and lactic acid dehydrogenase activity, which are used for biomarkers of early detection for muscle damage. However, there was no significant effect of vitamin D supplementation on serum blood lactate concentrations. Overall, the vitamin D supplementation of 200 IU for 3 weeks has positive effect on serum 25-OHD levels and may play an important role in prevention of muscle damage and skeletal muscle injuries. In this next study, titled Vitamin D Supplementation and Body Composition Changes in Collegiate Basketball Players, Hugh Butler et al. Looked into determine the vitamin D supplementation on body composition changes using a randomized control trial. So 23 NCAA D1 basketball players, which are both male and female, were blindly randomized to receive vitamin D supplementation or a placebo of gelatin capsules. The experimental group received 4,000 IU of vitamin D for 12 weeks. It is important to note that the participants receiving the vitamin D supplementation of 400 IU is a tolerable upper limit for vitamin D, which is completely safe and offers a high dose of vitamin D. Outcomes of vitamin D status were measured by serum 25-OHD levels, and body composition was measured by total body lean, fat, and bone mass. Results, next slide, please. Results of the study conclude that serum 25-OHD levels significantly increased in vitamin D supplementation group compared to the placebo group. A secondary outcome of skin color was also assessed to measure vitamin D differences between African American and Caucasian players. This secondary outcome demonstrated that baseline serum 25-OHD was significantly lower in African American players compared to the Caucasian players. There were no significant changes in body composition, but there was an increase in total lean and bone mass and a decrease in fat mass. It was just not significant enough to create a drastic change. Overall, vitamin D supplementation significantly increased 25-OHD levels individually, but did not significantly improve body composition. Further research should be conducted on what a safe supplementation of vitamin D is and some ways to significantly improve body composition and physical performance.
So antioxidant supplementation, including vitamin E and C supplementation, has recently received recognition among athletes as a possible method for enhancing athletic performance. Increased oxidative stress during exercise results in the production of free radicals, which leads to muscle damage, fatigue, and impaired performance. So in a study titled Effects of Acute Vitamin C plus Vitamin E Supplementation on Exercise-Induced Muscle Damage in Runners, a double-blinded randomized controlled trial, was proposed to view if supplementation of vitamin C and E had positive impacts on reducing exercise-induced muscle damage. The participants were randomly assigned into an experimental and control group. The experimental group was supplemented with vitamin E capsules containing 235 milligrams of DL alpha tocopherol acetate, and vitamin C capsules contained 1,000 milligrams of ascorbic acid. The placebo group just contained a capsule with maltodextrin. So the outcomes measured in this study were muscle damaged, analyzed via creatine kinase activity, lactate concentration, physical performance measured via a squat jump, a counter movement jump, and a stiffness test, delayed onset of muscle soreness, and rated perceived exertion. So the results from this study, oh no. Okay, so the results from this study showed that for physical performance immediately after the exercise protocol, the maximum counter movement jump and squat jump exercise was significantly higher than before in both groups. There was a significant increase in the elastic index percentage from pre to post exercise in the vitamin group. For muscle damage, results from the study showed that both groups had creatine kinase levels that were significantly higher 24 hours post-exercise protocol, but there was no significant difference between the two groups. In lactate levels, the blood lactate levels rose significantly from pre-exercise to post-exercise, but again, there was no significant difference between the groups. And for the DOMS and RPE, there was no significant difference between the experimental and placebo group. So in conclusion, this study does say that vitamin C and E supplementation does not have a beneficial impact on exercise-induced muscle damage. Additionally, there was another study that focused on vitamin C and E supplementation, but with resistance training. And so the title is the Antioxidant Vitamin Supplementation on Muscle Adaptations to Resistance Training, and it was a double-blinded randomized control trial. So the study was conducted to elucidate whether supplementation of vitamin C and E could affect the functional and hypertrophic adaptations produced in response to resistance training in healthy adults. Excuse me. So the experimental group received vitamin C capsules containing 1,000 milligrams of ascorbic acid and vitamin E capsules containing 235 milligrams of the DL-alpha tocopherol acetate. The control group received capsules of maltodextrin. Outcomes measured included body composition. So they looked at fat-free mass, soft tissue, and body fat, and physical performance was assessed using force, velocity, and power and hand grip strength testing. So the results from this study showed that for muscle strength, the isometric hand grip strength was only significantly improved in the post-intervention in the dominant hand of the control group, which was the group not receiving the supplementation. The muscle hypertrophy post-intervention, the variables of the fat-free muscle soft tissue for the dominant arm, the non-dominant arm, and total upper body mass were only higher in the control group. The experimental group did not have a significant increase in total or segmental muscle mass. And for body fat, there was a significant increase in total body fat observed for both groups, but only the placebo group showed an increase in visceral adipose tissue. So overall, the results from this study conclude that vitamin E and C supplementation group showed no improved outcomes other than it could help mitigate visceral adipose tissue gain. So some recommendations based off of the studies discussed today are, Jessica's going to go ahead and talk about vitamin B12.
So these are just some key takeaways from our presentation, recommendations for athletes. So for vitamin B12, it is recommended that they consume 2.4 micrograms to maintain brain and nervous system function, red blood cell formation, and anemia prevention, as well as regulating DNA. All right, and then Stephanie?
For vitamin D, based on the literature search that we conducted, we recommended that athletes consume adequate vitamin D over 1,000 IU daily to increase bone and muscle health for prevention of injuries.
And for vitamin C and E, it is recommended that athletes consume a diet rich in fruits and vegetables to meet the recommended intakes that were discussed earlier in today's discussion. And additionally, the study showed that supplementation of vitamin C and E does not enhance physical performance. So here we've created a handout. It's titled Vitamin Vitality. We have a short introduction about why vitamin intake is important. And we have descriptive benefits of vitamin intake on the side, along with photos of food sources that athletes could utilize to visualize what foods these vitamins come from. And lastly, we have our reference list, and we thank you so much for watching our lecture.